We've invested a lot of energy into addressing what is a global issue related to staffing. Recruitment efforts are underway, and we're doing everything possible to ensure that our hospital can continue to care for all of our patients. On behalf of all of HHS leadership, we're super grateful to all of you for your ongoing dedication to our patients and to our community.
In terms of what we're doing for Wave 4 preparations, certainly a lot of site-based planning and conversations as to managing through Wave 4 and what we'll do compared to what we did in Wave 3 with respect to our staffing and our care models. Significant focus, as you would expect, on pediatric planning led by Bruce, planning within our own children's hospital, but also playing a significant role in the regional planning, and of course planning with the other pediatric hospitals across the province.
These are data from the Ontario Science Table, updated just yesterday, looking at the effect of vaccination on COVID cases. And you can see here that the reduction associated with full vaccination is 85%. When we go down to hospital occupancy, the reduction is 95%. And vaccine will prevent ICU occupancy almost close to 97%. So these are very convincing numbers to validate the importance of vaccination.
Over 5,600 individuals at HHS now self-reported. That's a great number. We need to get to all. Effective September 7th, where all new hires will be required to have completed full vaccination. That's something that's being done in concert and alignment with our partners. Our goal is 100% vaccination of all of our people, which includes staff, physicians, and volunteers. Unfortunately, if you reported prior to August 29th, we have had to ask you to do that again, because in doing so, and to be compliant with the directive, we need you to provide the proof of that vaccination, and that is done through downloading your proof of vaccination from the Ontario Vaccination website.
We will begin sending out test kits to those individuals who have already declared that they are unvaccinated. We will be staging this approach, again, to give people the opportunity to report. We currently have around 6,000 reports, but we know that we still have a lot more to come in. So we will stage this process, and we are prioritizing and starting out with those who have declared that they are unvaccinated. All of the information related to the test kits will be included in that test kit. So all of the instructions about how to use it, there's a video, there are learning aids that are available. The kits are fairly easy to administer yourself and to read that result.
To support your learning, we encourage everyone to utilize this Orange Shirt Day and National Truth and Reconciliation Day calendar, which you see before you. It features a number of learning opportunities. In collaboration with Indigenous staff and physicians across HHS, we have compiled 94 learning opportunities throughout the month of September.
The directive is the bare minimum, and I fully expect that HHS will be going beyond the minimum with our own vaccination policies. We are doing that in close consultation with our legal department. Our in-house general counsel is part of the team that's helping to develop the vaccination policy. So I have a good deal of confidence that what we are doing is entirely legal. We will be respecting people's human rights. We will be making sure that people who have a legitimate exemption are respected for that. But as I stated earlier, we do also expect that everyone who does not have one of those valid reasons for not getting vaccinated will get vaccinated. And having to take a vaccine to work in healthcare is nothing new, and everybody who works here now has already had to comply with that requirement with respect to other vaccinations. So I do think we are on very solid ground. We take no pleasure in delivering messages like that, and we would not be doing it unless we were completely convinced that we needed to do so for the safety of your colleagues and for our patients, and ultimately for the good of our organization and this community. So thank you all for complying with the terms of that policy as we move forward. And with that, I'll sign off. Cheers, everybody.